This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Also provide healthcare services, including vaccinations, immunizations, consultations, medication management, and also educate our community about the various healthcare options. So, one of the popular topic of interest that is among our patients is the increasing cost of medications and the limited availability of solutions. So with that said, I would like to introduce Governor Sisolak, who is here today to announce a new drug savings program for the state.
Thank you.
Welcome, Governor.
Thank you very much.
I know.
Okay, who's that? Good morning, everybody. Thank you for being here. I appreciate it, and thank you for the kind introduction and hosting us at your pharmacy this morning. The work that you and your staff, and you see the staff hard working back there, and the pharmacy techs do every day helps support our mission towards a better and healthier Nevada for everyone. Before I get into the details of this very exciting, interesting, I think it's going to be a very well-received program, I'd like to thank our legislative leadership for joining us here today, particularly Senator Cannizzaro. It's fun to have her here, and I'm looking forward to hearing her comments as well. I'd like to also thank the Nevada Department of Health and Human Services staff, who've done so much behind the scenes to get us to where we're at today. This doesn't happen just quickly by chance. It takes a lot of work. And I'd also like to extend gratitude to the State of Nevada Board of Pharmacy for their work and their support of pharmacists statewide. Earlier this year, you might remember, I announced our intention to have Nevada join forces with Oregon and Washington as part of the Northwest Prescription Drug Consortium, now called ArrayRx. Prescription medications can get very expensive, extremely expensive, especially for our seniors on fixed incomes. Prescription medications are vital to the long-term health of our seniors as well. Today, I'm proud to announce that the program is up and running. Nevadans can easily enroll online for a free digital discount card that can save them money on prescription medication when they get to the counter. It's free to enroll and open to all Nevadans regardless of age, income, or citizenship. Signing up is easy at ArrayRxCard.com. When you go into a participating pharmacy, show your digital ArrayRx card to receive the discount at the register. Taking care of yourself and prioritizing your health shouldn't leave you bankrupt. And I will never stop in my mission to bring more affordable healthcare solutions to all Nevadans. That's why I'm so excited today to get this program off the ground and running and give hardworking families another chance to save some of their hard-earned money. Nevadans can save on average of 80% on generic prescriptions and up to 20% on brand name drugs. And I want to emphasize again, this program is free for all Nevadans. It's free to join. Once you go through the easy enrollment process, your digital card will be ready to use at the pharmacy. Again, it's simple. Go online to ArrayRxCard.com. Before I go, and because we're in a pharmacy, I'd like to remind Nevadans that flu season is quickly approaching. Please get your annual flu booster shot, and if you're eligible for COVID-19 booster, you can get that at the same time. Our work is to bring down the cost of living for all Nevadans, and our mission is far from over. But I'm excited to have partners in this mission, and the Nevada legislature who share this mission will continue to work with me and my team to create a healthier Nevada for everyone. So with that, I would like to introduce Majority Leader Senator Nicole Cannizzaro to say a few words.
Good morning, and welcome, first and foremost, everyone to Senate District 6, which is my Senate district right here in the Las Vegas Valley. So we're right in the middle of all of the folks that I represent up in Carson City. So welcome, and a huge thank you to Sally and all her staff and her team for serving so many of our Senate District 6 constituents and Nevadans throughout the state. I am so honored to be here with all of you today, and I have to give a huge shout out to our amazing Department of Health and Human Services folks who are working so hard to make sure that we are delivering health care to Nevadans here in the state. And a huge thank you to the Board of Pharmacy for being here as well. In the legislature, we've been really lucky to have a partner like Governor Sisolak, who has been a champion for making sure that we can tackle the problems of increasing healthcare costs, and specifically with respect to prescription drugs. And the Board of Pharmacy has been working with us to make sure that the legislation that we're passing to help everyday Nevadans be able to afford their prescription drugs is actually implemented. So as you can see, this is a team effort, and it really does take a community to be able to deliver to the folks who we represent and to make sure that people can live here, work here, and raise their family. I grew up here in Las Vegas. My parents were a bartender and a waitress. So if things were expensive, if prescription drug prices were too much, that was a decision where we were making the same things that so many Nevadans are today, where they're making a choice between, what bills do I pay? Do I get this prescription medication? How do I take care of my kids? And so everything that we can do to make sure that Nevadans don't have to face that choice is something that I am proud to be tackling at the legislature, along with Governor Sisolak and all of my colleagues. We've done a lot this last legislative session to increase prescription drug transparency, to help bring down the costs of things like diabetes medication and asthma medication. We've entered into legislation that allows us to do interstate compacts to bring down the cost of prescription drugs. And I think this is just another tool in our toolbox to ensure that Nevadans can continue to afford health care that they need and to take care of their families. But that doesn't happen by accident, right? That happens because, I would agree with Sally, there are so many constituents who this is a top piece of their mind. How do I continue to pay for things like my asthma medication? How do I make sure that I have access to a pharmacy and to affordable prescription drugs? And so every action that we can take to make that a reality for everyday Nevadans is something that I take seriously, and I know that the governor takes seriously. And that can't be understated, because these are real problems that Nevadans have, and we're working to kind of tackle these. And this is a great tool. I'm really excited to be here today to be talking about a way for all Nevadans, regardless of whether they have insurance or not, to be able to get a card to look for discounts on their medications that they need to live their lives. That's something that's really huge for everyday folks. And so that's something that I'm really excited to see implemented here. I know everyone over at the Department of Health and Human Services is going to do everything that they can to make sure that Nevadans know about this program. I'm so excited to have all of you here so that we can start spreading the word and get people enrolled. And again, just thank you all for being here today, because this is a really crucial piece of how it is that we make sure that people can afford to live, work, and raise a family right here in Nevada. With that said, I am going to introduce Luis Aceves, who is the Development and Implementation Manager for REACH Las Vegas.
Thank you.
Luis.
Good morning, everyone. Buenos dias. Thank you, Governor Sisolak. Thank you so much, Senator Sally. Thank you so much. It's my honor. I'm going to speak first in English, and after that, I'm going to try to speak in Spanish, okay? It's an honor for our organization just to be here. We are a 501c3 nonprofit organization serving our community through 11 years, providing free health services, education, and awareness to all of them, regardless their status. We primarily serve the Hispanic community, and we have two big concerns: access to healthcare and pay for the medications and the prescriptions. Sometimes our people need to choose between to pay their rent, food, groceries, or buy the medication. This is a light at the end of the tunnel. This is a light for our people and for every Nevadans. We are really excited, and we are really thankful that you are thinking about our community, our people, regardless their status, because we know that that is something that our people are always afraid to apply, to get access, and this is going to be for all Nevadans. REACH has been working really hard to try to get these solutions. Right now, we are working just to become a clinic so we're going to be able to provide more services, but this program will really help our people. We are pretty sure that once again, we're going to receive your support, Governor Sisolak.
Absolutely.
And I'm going to speak in Spanish right now. Mi nombre es Luis Aceves, soy manager de desarrollo de la organización REACH, una organización sin fines de lucro que se ha dedicado por más de 11 años para estar otorgando servicios de salud para toda la comunidad. Primordialmente servimos a la comunidad hispana y hemos tenido siempre dos grandes preocupaciones: que la gente pueda tener acceso a la salud y que la gente pueda pagar sus medicamentos. En muchas ocasiones, lamentablemente, la gente tiene que elegir entre comprar comida, pagar su renta o comprar su medicina. Esta ha sido una de las grandes preocupaciones. Nuestra organización actualmente se encuentra trabajando para convertirnos en una clínica y poder proveer servicios a bajo costo o sin costo. Pero este programa va a ser una luz para toda nuestra comunidad, que incluso podrá beneficiar a aquellos que no cuentan con un estatus legal. Esta es una de las más grandes preocupaciones que tenemos. Continuaremos trabajando y sabemos que el gobernador Sisolak continuará apoyándonos para poder acercar la salud a toda nuestra comunidad. Thank you so much. Gracias. Thank you.
And that's all we've got for folks. If we want to break into Q&A, we can do that.
Do we have questions you wanted to
Do you want to do a
ask?
couple at the podium, or do you guys just want to do Q&A outside? We'll take some photos if you guys want to head outside, and then we'll bring them out, and you can ask some questions.
I have questions, but
You want to ask them now?
Sure.
sure. So you said 80% off
Generic.
regular, rather, yes, generic, 20% off other drugs.
Correct.
Is that off the full price, right? That's not
Yes.
off the health insurance price. And does this primarily benefit people without health insurance?
Well, it benefits both. It'll benefit people without health insurance more because it'll be coming off. But sometimes the people with health insurance will be able to make the comparison. Here's what it is with my health insurance. Here's what it is with their ARX, and they can pick the one that's cheaper. So it'll give them an option right at the register. And I think some prescriptions it's going to save money. Some their insurance might be cheaper. But it's another opportunity, another option.
And we have Beth Slamowitz from HHS with us too, so we can have her chat with you as well.
That'd be great.
Yeah, and just a note on that too, there are a lot of people who also have high deductibles, and so for those folks, when their insurance copays don't kick in until those deductibles are paid, this will benefit those folks to be able to get a discount right off the bat.
Anybody else before we go outside?
Luis, is it possible in Spanish for this?
Yes, of
Sure.
course. Yes.
You don't want to take a stab at the Spanish?
No.
Governor?
Por favor, no.
So,
Lo
Luis,
siento.
algo importante, las personas que no tengan seguro médico pueden aplicar para esto también.
Efectivamente, las personas que no cuentan con un seguro médico o que no cuentan con un estatus en este país van a poder aplicar para este programa y beneficiarse de él obteniendo los medicamentos a un costo por mucho más abajo de lo regular.
Cualquier persona puede aplicar.
Cualquier persona, y en las oficinas de REACH, en nuestras dos oficinas, estaremos apoyando a la gente para que pueda inscribirse y para que puedan formar parte del programa y tener su tarjeta en el teléfono. Gracias.
Okay.
Okay.
We'll head outside. Sounds like Mary, you definitely want to talk to Beth.
Okay, good.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.